Hi everyone. Today we are going to be talking about medicine in the Middle Ages. So before I start, I just want to say that viewer discretion is advised. In this presentation, there will be videos that may be sensitive to others. Um, I just wanted to mention it, and I will let you know beforehand if there's going to be a video that has, some squeamish stuff in it, and I will let you know when to fast forward into the video. So without further ado, thank you, and I hope that you enjoy this presentation. We're going to be talking about a few things in this presentation. The first is going to be about the beliefs about medicine back in the Middle Ages, as well as some common medical procedures, medicine and astrology, and how they kind of tied into each other back then, and then also how physicians diagnosed. So to jump right in, physicians were considered to be servants of God. They were seen as blessed with the medical knowledge to treat others. And they also considered Hippocrates to be the father of medicine. So that's him right here. And then they believed that the body was made up of yellow bile, phlegm, black bile, and blood. And that was controlled by the four elements. So fire, water, air, earth. It was also thought that the body could remove the excess by bleeding, also known as bloodletting, cupping, and leaching. So we're going to explain what that is. So bloodletting is the surgical removal of a patient's blood for therapeutic purposes. So we know that bloodletting doesn't heal the body, and it's actually quite dangerous. You put the patient at risk of losing too much blood, as well as their blood pressure dropping, and if it drops too low, it causes them to go into cardiac arrest. On top of that, infection and anemia are also some other risks. In modern day research, we know that bloodletting does not cure ailments, but in the Middle Ages, they believed this. They weren't as advanced in technology, so this technique was used very frequently. So if you are very squeamish around blood, I ask that you please stop now and pause the video, as I am about to show something that is a little squeamish. Okay, so let's jump right in here. So right now you're going to be seeing bloodletting. And, this is just, I wanted you to see the water purposes of it. That's a very short clip, but I do have another one here, and it kind of shows the process of it. So you see this man, and he's like making small incisions or, making small slices in the skin, and it's going to cause him to bleed, and then they obviously drain it with the water, and that's what is bloodletting. This is actually done in another country. Hey guys, so welcome back. Right now we're going to be talking about cupping. So cupping uses a cup to pull an area of skin into a suction that decompresses the muscles and the connective tissue. So this is kind of what it looks like. Fun fact, it's still used today. In fact, Chinese medical practitioners believe cupping helps to keep the body in balance and increases the overall blood flow and can even reduce pain. So you're going to see in the video in a couple of seconds what it looks like and like the process and how it bleeds. So basically they light a fire into these glasses, and that basically helps to drop the pressure. And then they have acupuncture needles, and they prick that into your skin. And then they place the cups over top of the skin, and it kind of increases the blood flow, and then it draws the blood. And it will leave like welts and things. So that's kind of what you were seeing a little bit, or the welts on top of them, and that's the blood that's being drawn up. And then, like these are the welts and the bruises that can come from them. It looks very painful, but it's actually supposed to reduce the pain. Moving on, we have something called leeching. So leeching is the application of a living leech to the skin in order to initiate the blood flow or deplete blood from the localized area of the body. So I do have a video to kind of describe this, and it is a little squeamish as well. There is blood involved. So I would ask you please pause the video now, and then I'll let you know when to come back. Okay, so moving right along. This is leech therapy. So as you can see in the video, there's a leech right there. Basically, you pluck the skin with something. You can either use a needle and prick it, or you can use a scalpel. Just you need to do something to make sure that the patient is bleeding. And they place the leech there, and then it takes a minute to leech on, but it's attached to the open site, the open wound site. And then basically they just suck your blood. And then as they are sucking it, the leech itself actually expands and it like swells up. And then once it's done taking out all the blood that it wants, it will detach itself, and then you put it in a separate container. And that is basically what leeching is. Okay, so welcome back, everyone. We got all the rough stuff out the way. So now we're going to be talking about medicine and astrology. So in the Middle Ages, medicine and astrology kind of worked closely together, especially with the physicians. So the physicians would often schedule procedures based on the position of the moon. And they carried out around special calendars with illustrated star charts. And they would check to see the position of the stars before making a diagnosis or planning any procedures. This is what they would carry around with them. There's a little guy in the middle, and he'd kind of be pointing. So depending on where everything was aligned, it would say, oh, no, don't do this during this time. So right here is just this chart that I made for you guys. And it basically, all the horoscopes have a certain time period. Like, for example, I know that the Leo, the last day for that is August 22nd. So basically, during these certain time periods, they would say to avoid certain things. So if it was in that time where, Leos would be born, you would avoid the incisions of the nerves, that sort of thing. If it was around the Cancer time, avoid incisions in the breast, side, stomach, etc. So going forward, how did physicians diagnose? Well, one of the main ways physicians would diagnose illness was through examining stools, blood, and urine. I think I mentioned it in my blog, but just to say it again, stools are poop. You know what blood is, it goes through your veins, and urine is pee. So images of doctors look like this. So this is actually the doctor himself. But as you can see, there's these vials right here, and that's what they would use to inspect the blood, stool, or urine. And that's better depicted right here. And so what's nice about this is that we still use this practice now. For example, if there's blood in your stool, it tells us doctors that there may be colon cancer present, or even down to your urine. If your urine is clear, it shows that you've been drinking a lot of water. If it's a yellowish color, it'll show that you've been drinking juice or some other beverages. So I just want to say thank you. That is the end of the presentation. I hope that you learned a lot about the medicine in the medieval times and, see the similarities and the differences in how we practice now. I used these sites to kind of help me gather my information together, and I hope you enjoyed it. Thank you.